Stomach pain is one of the most common complaints that a doctor will see, but more often than not, it's nothing to worry about. But sometimes stomach pain can be an indicator of some things that are more serious. Helicobacter pylori, also called H. pylori, is a type of bacteria that can enter your body and live in your digestive tract. Its symptoms include nausea, loss of appetite, frequent burping and bloating, unintentional weight loss, and an ache or burning pain in the abdomen, which is worse when your stomach is empty. Since there is a whole lot more going on in your midsection than just your stomach, it's wiser to seek medical attention than to ignore potentially serious symptoms. Dr. Lilly Tran of Advanced Gastroenterology and Surgery Associates explain how they detect and treat patients with H. pylori.
H. pylori, which is short for Helicobacter pylori, it is a bacteria, but unlike other bacteria, it prefers to infect only in the stomach. So therefore, it doesn't go to the blood system, it doesn't go to the brain, it doesn't go to other organs. And it's quite prevalent out there. No one knows exactly how it's transmitted, whether it be respiratory, orally, somehow it is ultimately ingested and settled into the stomach. It is a chronic infection that causes inflammation to the lining of the stomach. It can cause symptoms of pyrosis or abdominal pain, nausea, belching, so all those GI symptoms. In the long run, it can cause stomach ulcers. In a very small percentage of patients, it can cause stomach cancer called B-cell lymphoma. Now, in the United States, there is not a screening program per se for every person who walks through the door, especially asymptomatic patients. So patients who come in with these generalized GI symptoms, abdominal pain, nausea, bloating, the primary care usually will check a blood test called an H. pylori serology. And if that is positive, then they will be treated. If that has not been done, and let's say the patient presents to our GI clinic, and when we do endoscopy, we do biopsies, and we check for the bacteria that way as well. And the condition is very easily treated with antibiotics.
You know, when I was training back in the day, a lot of patients went to surgery for peptic ulcer disease. Now that's extremely rare. We don't see the complications of having peptic ulcer disease like we did in the past, like obstruction. The most common reason people get peptic ulcer disease, Helicobacter pylori. So the discovery of that bacteria was extremely important, and I think Barry Marshall actually got the Nobel Peace Prize for it. We didn't know in the past that peptic ulcer disease was an infectious etiology. But since the advent of eradication of H. pylori, that has decreased the incidence of peptic ulcer disease dramatically.
You can find information on Advanced Gastroenterology and Surgery Associates when you click the Misery in the Midsection story link icon on our homepage, yourhometownhealth.com.